you're a student looking to become a dermatology provider or you're a new dermatology provider, these are my top 5 tips for clinical practice. Number 1 is during your first year of practice, really just focus on clinical dermatology and diagnostics. Unless you're solely performing aesthetic procedures, really hone in on your diagnostic skills and really get in the books and study it, because clinical dermatology is the foundation. It's going to make you a more well-rounded practitioner if you really know your stuff. So yes, you can do cosmetics, you can do surgical procedures, all the things within the realm of dermatology, but I highly encourage you to really just focus on the diagnostics during your first year. Number 2 goes hand in hand with number 1, and that is to never stop reading. A big mistake that I see a lot of providers do after their first year or so of clinical practice is they just stop studying. They stop reading, and the truth is, medicine is constantly evolving. And contrary to what many people may think about dermatology, it's actually very challenging. And a lot of rashes look the same. Not everybody has an eye for it. So it takes a lot of experience and a lot of studying and really getting in the books and the articles to really know the differences between these conditions and how to tell them apart. So I'm in my 4th year of clinical practice and I'm constantly learning. I'm constantly in the books. That's a big deal. Now, number 3 applies to all aspects of healthcare, but never let a patient or a colleague pressure you into doing something you're not comfortable doing, whether it's a risky procedure, overbooking your schedule, whatever it may be. If you're not comfortable, don't do it. As a healthcare provider, your top priority is to protect your patients and to protect your license. So if you're not comfortable doing something, learn to say no. Set boundaries and set them early. Number 4 is utilize your drug reps. Pharmaceutical reps are such a valuable resource, especially when starting out, when you're learning these medications and how they work in terms of insurance. So if you're dealing with, step edits, prior authorization nightmares, let them help you. They're very, very valuable. And number 5 is to invest in a go-to resource for studying and or looking up a condition quickly. There's so many resources and textbooks in the world of dermatology that it can get very overwhelming. So personally, I invested in Visual DX, and this is a subscription platform where you can look up practically any dermatological condition, and it's going to give you an entire synopsis on that condition, basically everything you have to know about it, a million photos, differential diagnoses, how to work up the patient, and of course treatments. And Visual DX also offers a lot of quizzes that you can take. So I would really utilize that to really sharpen your skills and hone in on your recognition.